Hello. My name is Monica Brinzak from the Department of Public Health, BBU Cluj-Napoca, Romania, and we are one of the Be Well project partners. It will be my pleasure to be your trainer today. This training module will provide you with awareness and skills for managing stress at organizational level, in continuation to the previous module focusing on managing stress at individual level, especially in situations which are relevant for the health and care operators. Stress at organizational level in the healthcare settings. Please remember from the last module that not all stress is bad. Pressure at the workplace is unavoidable due to the demands of the contemporary work environment. Pressure perceived as acceptable by an individual eustress may even keep workers alert, motivated, able to work and learn, depending on the available resources and personal characteristics. However, when that pressure becomes excessive or otherwise unmanageable, it leads to stress or distress. Healthcare workers face in particular challenging working conditions and high stress levels that can lead to poor mental and physical health. Long hours, hazardous conditions, and exposure to suffering and death all affect workers' psychological, emotional, and social well-being. Below is a list of stressful situations in a general organizational context. Job content. Monotonous, stimulating, meaningless tasks, lack of variety, unpleasant tasks, aversive tasks. Work demands. Includes issues such as the volume of tasks, the usual way of accomplishing them, the work environment. Role fulfilled. On how well people understand their role in the healthcare organization, and whether the organization ensures that people do not have conflicting roles. Perceived control. How much control the individual has in how they carry out their tasks. Support received. Includes the encouragement, support and resources provided by the organization, direct manager and peers. Organizational culture. Poor communication, poor leadership, lack of clarity about organizational objectives and structure. Organizational change. How organizational changes, large or small, are managed and communicated in the organization. Interpersonal relationships. Includes promoting a positive work environment to avoid conflict and manage unacceptable behavior. In particular, in the healthcare settings, the healthcare operators are facing stressful situations such as intensely stressful and emotional situations in caring for those who are sick, exposure to human suffering and death, unique pressures from relationships with the patient, family members, and employers, long and often unpredictably scheduled hours of work related to as-needed scheduling, unexpected double shifts, unpredictable intensity of on-call work, high administrative burdens and little control over schedules. Stress management. How to decrease stress levels in healthcare organizations. Although as mentioned before, healthcare operators are facing some particular stressful situations, there are some general simple solutions for managing the stress at organizational level. Act with integrity, be honest, treat colleagues with respect, do not talk about team members in their absence. Manage emotions. Act calmly and coherently in stressful situations. Avoid transmitting own stress to team members. Take suggestions for improvement from the team. Considerate approach. Offer more positive feedback than negative feedback to other colleagues. Allow your team to handle their work in their own way. Show consideration for your team's work-life balance. Communicate with your colleagues and supervisors about job-related stress. Identify factors causing stress and work towards a solution. Set priorities. Talk to your supervisor and ask what is expected of you. Even if your agenda is overflowing and you still have several tasks to do, then you often know where your priorities lie. Plan and forecast proper workforce. Ensure proper staffing levels to avoid overwhelming workloads and prevent burnout. Foster an environment of supportive leadership, open communication, regular check-ins, training leaders to listen and resolve issues effectively. Create a positive work environment that is respectful, with recognition programs and clear career pathways in place. Measures to address workplace bullying or discrimination. Encourage better work-life balance through flexible working arrangements. Access to caring facilities for professionals with young children, if possible. Boost physical exercise incentives. Availability of subsidized bicycles for professionals to use. Access to green spaces for walks, etc. As homework, discuss with your colleagues and identify the top 3 organizational bottlenecks that are causing stress, and what measures need to be implemented in the organization to improve the situation. Now for the reflection moment. What was the last conflict you had at the workplace? How did you resolve it? Could it have been resolved better? We are now at the end of the first module, Develop Stress Management Skills for Health and Care Operators, of the course Develop Resilience for Health Operators. Thank you, and we'll meet in our next lesson.